The ongoing battle over SNAP benefits has left millions of families wondering whether their November payments will arrive in full, partial, or not at all. Following a major legal twist, the Supreme Court has temporarily paused the nationwide order requiring the government to fully fund SNAP during the shutdown. Yet, before the decision took effect, multiple states had already processed and distributed their payments, some completing full benefit loads on EBT cards as early as November 7th. This uneven rollout has created an unusual situation. Depending on where you live, you may have already received your entire monthly allotment, only a small portion, or still nothing at all. For those who depend on SNAP to feed their families, this confusion couldn't come at a worse time. State agencies are now working overtime to clarify guidance from the U.S. Department of Agriculture, USDA, while recipients monitor their EBT apps daily. In today's update, we'll detail which states are still paying full SNAP benefits, which have paused payments, and what's coming next for December. Before we begin, don't forget to like this video, subscribe to Social Security Post, and share your state in the comments to help others stay informed about where full SNAP payments are actually being made. In the first week of November, the Trump administration appealed a lower court ruling that had ordered the USDA to release full SNAP benefits, despite the ongoing government shutdown. The appeal argued that the administration lacked lawful authority to spend money not approved by Congress, citing the Anti-Deficiency Act, which prevents federal agencies from making financial commitments without legislative funding. On November 8th, the U.S. Supreme Court granted a temporary stay, effectively freezing that lower court order while it reviews the case. This action halted the release of billions in SNAP benefits, even though several states had already initiated full disbursements to their residents. The government claimed it did not have enough emergency funds to meet the roughly $4 billion requirement for full payments. However, critics point out that contingency funds exist within USDA accounts, and that states had already used similar mechanisms to issue partial payments earlier in the shutdown. The timing of the court's decision left thousands of agencies uncertain about whether to stop, continue, or reverse the benefit uploads already underway. As a result, millions of Americans now face inconsistent access to food assistance, proof of how rapidly legal and administrative decisions can affect real families. Even amid federal uncertainty, a number of states moved quickly to protect residents. California, Kansas, New Jersey, Washington, New Mexico, Hawaii, Oregon, Wisconsin, and Massachusetts confirmed that they issued full SNAP benefits for November before the Supreme Court's block. These states acted on the initial court order, prioritizing households that rely on monthly food aid. Their agencies worked extended shifts to process millions of transactions so funds could post to EBT cards by Friday, November 7th, ensuring recipients had immediate access to food money while the ruling was still valid. Other states also completed or are still honoring full benefit distributions. In Massachusetts, officials verified that all delayed payments were recredited to accounts by Saturday, November 8th. Colorado reported that about 32,000 recipients received full payments before the pause, though more than 560,000 others remain in limbo. New York promised residents that full November benefits would reach cards by or starting Sunday, November 9th, while New Hampshire, Arizona, Connecticut, and Minnesota said they would complete full payments over the weekend using state reserves. These examples show that many states decided to prioritize food security, choosing to act first and argue later, while Washington's legal fight continued. Several states were forced to pause or reduce payments once the Supreme Court's order was announced. North Carolina had already begun issuing full benefits on Friday but stopped the next day, leaving about 190,000 households receiving only $16 or less as a temporary hold payment. The state's Department of Health and Human Services confirmed that updates will depend on federal guidance. In Texas, an announcement made around 3:30 p.m. on November 8th stated that full payments were processing, but feedback from residents has been mixed. Some report seeing funds, others say their cards remain empty. Michigan has provided clearer assurance, confirming that all recipients will eventually receive full benefits according to their normal schedules. Those scheduled for the 3rd, 5th, and 7th were prioritized and funded within 48 hours once state deposits cleared. In contrast, Alabama and Florida have remained silent, waiting for USDA instructions before releasing further payments. Many additional states have now paused entirely, uncertain whether to risk disbursing funds that might later require reimbursement or clawback. This patchwork approach underscores how fragmented SNAP delivery has become, where one state's families are shopping freely while another's are still waiting for their first dollar of aid. While most states focus on getting payments out, Georgia has become the first to begin enforcing new federal work requirements tied to the Big Beautiful Bill Act, H.R. 1, passed in July 2025. Effective November 1st, able-bodied adults without dependents must now work or participate in approved training for at least 20 hours each week to maintain eligibility for SNAP. The Georgia Department of Human Services estimates that roughly 96,000 people out of 1.4 million SNAP recipients could eventually lose benefits because of this change. These rules shorten recertification periods to every 4 months, creating more frequent reviews of work documentation and employment status. The policy also tightens exemptions. Caregivers are now exempt only if caring for a child 14 or younger. Previously, the age limit was 18. Failure to meet the requirement limits eligibility to just 3 months within any 36-month period. However, pregnant individuals, those medically or mentally unfit to work, and anyone receiving disability benefits remain exempt. Georgia's implementation acts as a pilot for the nationwide expansion expected by 2027, when H.R. 1 provisions will push similar requirements across other states. For thousands of low-income adults, these new rules add another layer of uncertainty at the same time that federal benefit payments are already in crisis. The legal fight quickly escalated into a political showdown on Capitol Hill. Senate Minority Leader Chuck Schumer publicly condemned the administration's appeal, calling it pathological levels of vindictiveness to fight against food aid for struggling families. Schumer argued that the administration could fix SNAP today simply by authorizing existing USDA funds, but instead chose to appeal for political leverage. He accused the White House of using the shutdown to punish ordinary Americans who rely on programs like SNAP and Medicaid to survive. His statement resonated strongly among lawmakers and advocates demanding an end to the partisan standoff. Schumer also linked the SNAP funding battle to broader shutdown consequences, such as unpaid air traffic controllers and delayed federal salaries, warning that political brinkmanship was crippling both workers and beneficiaries. He emphasized that the humanitarian cost of delayed food aid far outweighs the administration's legal objections, urging immediate action to restore payments. This rebuke highlights a deepening divide in Washington. While one side argues fiscal restraint, the other sees moral failure in withholding food from families, seniors, and children during an economic squeeze. Even if the shutdown ends soon, uncertainty over SNAP and Medicaid will persist. Under the Big Beautiful Bill, H.R. 1, Congress plans to cut $1 trillion from federal Medicaid spending over the next 10 years, starting in fiscal year 2027. Adults aged 19 to 63 would need to work, volunteer, or be enrolled in educational programs for at least 80 hours per month to maintain Medicaid eligibility. States will bear more responsibility for verifying work hours and exemptions, potentially overwhelming local health and social service offices. The exemption age for SNAP work requirements would also rise from 60 to 64, tightening standards for older workers who might already face health limitations. State governments have been told to prepare now, with roughly 6 months to design compliance systems once final federal guidance arrives. This means states will need to coordinate data between workforce agencies, schools, and health departments, an enormous administrative challenge that risks delays and coverage losses. Many advocates warn that these combined SNAP and Medicaid changes could remove millions from assistance roles nationwide by the late 2020s. In short, even after the immediate shutdown crisis passes, the broader structural shift towards state-level control and stricter work enforcement will continue reshaping America's safety net programs. For anyone currently depending on SNAP, the most important step is to monitor your EBT app or online state portal daily. Payment statuses are changing rapidly as states reevaluate how to handle November benefits. If your benefits have not arrived, contact your local Department of Human Services, but expect long hold times. Keep screenshots and receipts of any benefits received or purchases made. These records could be crucial if the USDA later requires states to verify payments or reclaim funds. Some states have hinted that if clawbacks occur, they will seek to shield low-income households from repayment obligations, but official guidance remains unclear. For Medicaid and SNAP recipients in Georgia and other early implementation states, start organizing documents that prove work hours, training participation, or medical exemptions. Keep copies of doctor's notes, disability letters, or employment forms in a safe place. It's also wise to review your recertification schedule, as missing paperwork or failing to report a change could suspend your benefits automatically. These proactive steps ensure you stay compliant with upcoming rule changes and protect your access to critical programs during this unpredictable period. As of now, the nation's SNAP map looks divided. Some states have successfully distributed full November benefits, others remain frozen under the Supreme Court's order, and a few are preparing entirely new systems under H.R. 1 reforms. The next several weeks will determine whether the Supreme Court lifts the stay or upholds the administration's appeal, which would decide if full funding resumes. Meanwhile, December benefits hang in the balance, and millions of families are left planning their grocery budgets day by day. Stay tuned here on Social Security Post for fast, accurate updates on SNAP, Medicaid, SSI, and Social Security changes. We'll continue tracking which states process full payments, what the courts decide, and how federal budget negotiations could affect you. If this video helped you understand what's happening in your state, please like, subscribe, and share it so others don't miss critical updates about their benefits. Your engagement helps keep everyone informed during these uncertain times.